All right, now let's go to the UK. A steroid, dexamethasone, is the first drug shown to help save severely ill coronavirus patients. Scientists at the University of Oxford say the drug, a steroid called dexamethasone, would be the first treatment shown to reduce mortality in severely ill patients. So the drug appears to reduce inflammation caused by the immune system protecting the tissues. So in that study, the drug reduced deaths of patients on ventilators by 1/3 and deaths of patients on oxygen by 1/5. SABC correspondent in London, Stuart Smith, joins me now live. Thank you very much, Stuart. Thanks indeed for your time. So is it being hailed as groundbreaking? Of course, it's not a vaccine, but a drug which reduces death in critically ill patients with coronavirus.
Yeah, that's it. So it's important to stress this is not a vaccine. This is something that is given to people once they already have coronavirus, and at that only when they're very seriously ill. It's not something that should be taken by anyone as a precaution. It should only be administered in hospitals. But it is a steroid which is widely available. It's very cheap, only $30 for a full treatment. And what's even better is nurses and doctors in hospitals will be very familiar with this drug. It's used to treat all sorts of different ailments where inflammation is involved, and that's what makes this drug so powerful. It heals the lungs once they get infected and then brings down that inflammation.
South Africa is still having discussions about, when, if it will then administer this drug to critically ill patients who have the coronavirus. Have hospitals in the UK began administering this drug to those patients?
Yes, it has. And in fact, this announcement was made in the UK in the afternoon. By the evening, the government had already changed the law to allow doctors and nurses to give this to patients. It was seen as such a groundbreaking major breakthrough that there was no time to delay. And in fact, they stopped the trial early because the doctors and the researchers administering the drug realised that this is so powerful that it was unethical to continue allowing the people, the control group, the people who didn't have the virus, it was unethical not to be giving it to them. That's how these trials work. You have one group who doesn't get it, one group who do, and they said it's unfair to the group not getting this drug to stop the study.
Is it yet to go through a peer review, I understand?
Oh, could you say that again? Broke up there.
Is it yet to go through peer review?
Yes, it is. And this is hundreds of hospitals in the National Health Service, part of the UK's public health system, took part. And it's all going to be peer reviewed. The paper with the information, the details, all of the data will be available to people to scrutinise later in the month. For now, though, it's just the preliminary result, so important that people said we just have to get this data out there.
I think in terms of, the fight against the coronavirus globally, what are the health experts saying there in terms of everyone agreeing, of course, this is not a vaccine, but the fact that had this been discovered a little bit earlier, you could have had thousands of lives that could have been saved, Stuart.
Yes, that's right. And that is one of the saddest things about this, that it's such a widely available treatment. It's so cheap. If people had known about it earlier, then that would have made a big difference. At the beginning of the pandemic, the World Health Organization was eager to stress people should not be taking steroids because they can and do have negative side effects if improperly administered and if administered at the wrong time in treatment. But these things do take time. It takes time to run these trials to find out whether something really is good for people or whether it could have side effects. Steroids in particular can be dangerous if used improperly. So it is something that if it had been released earlier, it would have made a difference. But the danger always was that if you said to people this is something that could help cure COVID-19 and then it turns out to make the situation even worse, well, that's an even messier situation. But it's good to remember it's not just antivirals and things like that are available. Steroids as well as vaccines are being researched as well as other treatments. So it's not just steroids that are being researched right now. All sorts of things in many different countries are being looked at.
SABC correspondent in London, Stuart Smith, joining us live. Thank you very much indeed for your time this evening. So